Hey everyone, I'm Lauren Fleming with Hem Supportwear, and today we have Chelsea Tetreault she is a doctor of physical therapy at Bespoke Physical Therapy in Rhode Island, and she specializes in women's pelvic health and orthopedics. So we have her here to talk all things pelvic health with us today, and we're so excited to have you, Chelsea. Thanks for being here.
Yeah, thanks for having me.
Yeah, so can you tell us a little bit about your background and what inspired you to specialize in this area?
Yeah, so growing up, I was pretty active. I was a gymnast. I ran. I had my share of injuries, so that's kind of what got me into physical therapy from the start, like as a young athlete. And then in physical therapy school, I actually went more the like orthopedic sports medicine route right away. So I got out of school in 2014, and I started practicing in like an orthopedics clinic. Um, and at that clinic, we started seeing a lot of patients coming in for pain during pregnancy. So that's kind of how it all started. I started taking a little bit more coursework to be able to work with the obstetric population and have a little bit more info. And then from there, I found I wasn't able to like fix everything I wanted to with them. So their pain would go away, which is why they would go into therapy. But sometimes they would say, "Oh, I'm still not going to the gym because like I found I'm leaking," or now during pregnancy or postpartum, I'm having these other symptoms. And that's when I started really diving into like the pelvic health world and took my first class through Herman and Wallace, where I learned all the different like external, internal, a lot of the more pelvic floor techniques. So I could really feel like I was capturing all the symptoms these patients were having and kind of bringing them all the way through. So it started by really using my orthopedic skills and then realizing that there was this huge need on like a quality of life piece that I just felt wasn't really getting captured in these patients. So then the rest is history. So
Great. Yeah. Thank you so much for sharing that. I feel like it's always neat to see like how it can kind of start in one place and then you like hear, things that aren't getting fully addressed and how that can, adjust your course. So it's cool to hear that experience. Thanks. Can you tell us a little bit about what a typical day or maybe week looks like for you with your practice?
yeah, so right now being like a small business owner, you wear all the hats. So I spend part of my days doing like administration work. I spend that time, talking to patients, returning phone calls, any paperwork, business stuff. Um, I'm spending a lot more time also like building my like tribe in the community. So a lot of our patients, they have more I should say, like other things that I want to be able to provide them a resource for. So I've been working on networking, meeting with other providers, whether they're dietitians, therapists, exercise, um, or personal trainers, exercise scientists. And then the bulk of my days are treating patients. So I do one on one patient care. I'll schedule them for an hour each for their follow-up visits, which is really cool because that's not always the case and not always given to us in our healthcare system. So I get to spend a lot of time with my patients. And then I usually finish up my day with a little more admin work to get some notes done and tie everything else up.
Nice, great. Thanks for sharing that. I enjoy getting to hear the glimpse of like what this looks like for different people and how that varies. So it's very cool. Thank you. If you're explaining the importance of pelvic health to someone who's never heard of it before, how would you do that?
I always relate it back to function. So people tend to know like what they can do with no problem in their day-to-day life and then
Yeah.
where they have a harder time. So functionally, like people know if they have a shoulder injury, like sometimes bathing or getting dressed or lifting their kids in and out of the car can be difficult. But we'll talk about more functionally how our bowels, how our bladder, how our core, all of that functions. And from there, kind of if someone is like, oh, well, what are some of the things they might be experiencing? We might talk about like bladder symptoms, bowel symptoms. I feel like usually comes up pretty organically when someone has questions about what I do. There's like one specific girls night I remember where I was at my friend's house and there was like six girls there. And once we after dinner like sat down and we were just like sitting on the couch, my friend who was hosting it was like immediately defaulted to this like pain position on the couch. And I asked her, I was like, "Are you feeling okay?" And she was like, "I'm so nauseous. Like I've been constipated all week." And I asked her, I was like, "Do you have a plan?" And she was like, "No, I have no idea what to do." Um, So I was like, do you want some tips? Like, you don't have to take them. It's girls' night, but if you want them, I'm more than happy to help. So I taught her how to do a bowel massage, and I had her just do some stretches with her legs up on the wall. And I'm not kidding, that week, out of the 6 girls that were there, at least 3 of them that week texted me and were like, oh my gosh, Chelsea, like I did the things and like I've never felt better in my life. So it's like things like that whole group of girls that I were with, like they weren't sure what I necessarily do for work, right? And then it just kind of comes up and we talk, like as I was talking about it, they're like, wow, this is so cool. I didn't know pelvic floor PTs did that. It also makes me feel really old because the girls' nights we're now talking about like bowel movements, but
Right.
um,
Right.
but I feel like that's why when I talk about function, like it all comes back to like people know what they're having a hard time with. And we think
Yeah.
of it from a lens of like with musculoskeletal pain as like activities, whereas like daily function is still something that as physical therapists we can help patients with. So
Mhm. No, I think that's funny, just like how our conversations do change as we get older. But I
right.
think the point about like too, like when you kind of talk about it for one thing and then it brings it up for others, like I've found that even myself where I will start talking about these things more and more, especially like with me having pelvic organ prolapse after my first kid. It's one of those things where it's like I had never talked about that or heard about it before, but then you talk to more and more people and they're like, oh, my aunt has that, or my friend has that, or my mom has that, or I think my mom had that. Just it is interesting. The more we talk about these things, the more that so many people who are very close to us are dealing with it. So
Yeah.
that's something I've experienced a lot over these last few years.
Yeah. I love that people are talking about within with like their comfortable circles, right?
Yeah,
Like who
of
they're
course.
comfortable with, they're bringing it up
Yeah,
more.
right.
So
Yeah, it's a good change for sure.
yeah.
I also know too, like, there's a lot of we're seeing more and more information on pelvic health, and then along with that, of course, comes some misconceptions. What are like one or two that kind of rub you really the wrong way, or and that you see a lot?
Yeah, I think one of them is like who it's for. Like that's a really common misconception. Obviously, I have a passion working with patients who are pregnant postpartum, but even a lot of my friends will say like, "Oh, I'm coming to you when I'm pregnant," but they might have pelvic floor things before pregnancy and postpartum, or after pregnancy postpartum. I see gymnasts who leak when they're tumbling. I see patients who have endometriosis and have pain that they're working through. I have patients going through menopause who have symptoms. We have patients who are being seen after like prostate surgery. We have pediatrics seeing pelvic floor physical therapists. We have a lot of neuro population patients who need pelvic floor physical therapy because of bladder changes. So I think one of the biggest misconceptions is like who it's for.
Yeah.
It's great that it's definitely like maternal health care, like it's time that people are knowing that this is a
Yeah.
thing. So I love that. It's really opening the door, but it's not exclusive to that,
Mhm.
which is one of the things. And then the second thing I would say is, and I bet every single physical therapist says this, is it's not all about Kegels.
Yeah, that's a big one.
Yeah, it's very much like people come in and they're like, but I do my Kegels. A lot of the time we're talking about like more lengthening or tension or coordination of the pelvic
Yeah.
floor. But I never get like upset that someone knows about a Kegel because like they knew something, right? So I
Right.
love to be able to help educate them. But
I
definitely people think it's a Kegel and that's
Yes.
it. So,
Right, right, which I think is a great kind of like segue for people into understanding more about it because they think, okay, Kegels, my pelvic floor needs to be strong and then my problems will be fixed. And it's like for a lot of people, tension, might be causing those issues and it's more about relaxing and lengthening. So it's
yeah,
so dynamic. And yeah, to your point, it's like it's good they know something.
yeah.
And I think it often does open up for a broader discussion, when people start to talk about that initially and how complex like all of that is together and how different things can cause different issues. So
And like
yeah,
you've talked about with prolapse, like a lot of the patients come in and they feel like they can't relax their pelvic floor because they're like, if I relax, like everything's gonna fall out. I'm like,
yeah,
no, that's not how it works, even though that's what we like our bias wants us to think, right? Like we
right.
have to hold our muscles to hold everything up.
Right.
And so it's a lot of education on we might need to strengthen your pelvic floor, but we kind of have to do a thorough assessment and figure out why and what's going on.
Hmm.
Um, and letting patients be confident that if they relax their pelvic floor, everything's not going to fall
Right.
out.
Right. And they can, I know that because that's another thing too that's interesting that I've like observed a lot myself is since having prolapse, it's one of those things where it's hard to explain to people. Like when your body is functioning the right way, you don't think about it. Like you don't think about when moving your arm or walking or doing those things. Whereas like once it's not working, that's when it's top of mind and you're having to think about, oh, I'm holding my muscles so things don't fall out. And that's like it is hard to like to navigate that for sure. Like this is it's constantly top of mind and you're trying to live your day-to-day life and figure all these things out at the same time.
Yeah, you're like trying to problem solve something that you didn't even know could possibly exist.
Right.
Like a lot of
Exactly.
my patients are like, I didn't even know this could happen to me.
Right. Yeah, I know. I tell some people I'm like the biggest ones is when I will go through a day and I don't have to think about it. It goes back to like, okay, I can just walk or carry my kids or do whatever and like I'm not thinking about it. That's a huge win.
Yes, yes,
Yeah.
absolutely.
It's a big shift for sure. Are there like exercises or habits that people should be mindful of? I of course know that everyone's unique and depending on, if things are tight or relaxed or what all those things, it's a personalized thing, but are there general habits that folks should keep in mind for good pelvic health?
Yeah, I think the first one that all of us could probably be better about, and I don't want to generalize everyone, but I would say most patients I ask this question to, everyone tends to run a little more dehydrated.
Mm,
So first one's hydration. Like hydration has a huge impact on our bladder function, our bowel function, how our tissues, so all of our soft tissues, the way that structurally they function, they're very reliant on hydration and water. So first, one of my tips is like, make sure you're well hydrated. Our bladder can act up, our bowels can act up, and our tissues and muscles have a hard time being efficient if we're dehydrated. So first tip is definitely hydration. For most people, obviously there's some people who like crush it. I know a lot of my patients who are currently lactating are like really good at slugging down
right.
fluid, but not all, but that's okay. So that would be my first one. And then just knowing like, the way we treat and respond to our bladder and our bowels are a little different. So, our bladder, we don't always want to necessarily pee every time we think we could pee. So,
Mhm.
like normally we should be able to go about 2 to 3 hours without having to pee. If we go more frequently, we might create a habit. So, I usually tell a little tip of try to go when you think your bladder is full, but not out of habit of going too soon with the bladder. And then bowels, I tell all my patients, if you get the urge, please go. We don't want to miss the bowel cues. We don't want to cause us not having cues again the rest of the day. So that's how the bladder and bowels are a little different. And so for those tips, I would say bladder is we want to really spread it out a little bit. Bowels, when you get the urge, please go.
Mhm.
That means your gut's already working and kind of setting the stage for everything to happen. And in terms of exercise, just having really good mindfulness, like if you're able to deep breathe and feel tissue relax, and then if you're able to, when you're trying to connect or contract or get a muscle to respond, just having really good mindfulness can help a lot of patients, is
Mhm.
just knowing that all of our muscles have ability to lengthen and relax, and they all have an ability to shorten. And sometimes just like tapping into that mindfulness can be really helpful.
Mhm. Great. Thank you. Another question I wanted to ask you about is how we talked about this a little bit, like, because how you were saying that a lot of people like learn about pelvic floor physical therapy during, pregnancy and postpartum. Can you talk a little bit about how it can be helpful over the course of your life as things change outside of just that one important time?
Yeah. So a lot of times postpartum, a lot of people think like early postpartum, but there's also that phase where you might be your children a little bit older and now you have more time for you and you want to get back to being active. It's still, in my mind, considered postpartum if that's kind of where your activity levels changed. But there's just like general returning to fitness, knowing that tissues might be a little bit different, or that you haven't been able to use them in a few years. So that's one way that we can, it's still technically postpartum, but not necessarily postpartum. If they're coming in, it's not usually on the referral or from their provider
Mhm.
that way. A lot of my patients, I actually see some usually girls that are around the age of becoming more sexually active who might have pain with penetration. So I work near a local university, and they have a really wonderful physician at their student health center that refers a lot of the patients out that are discussing like having painful pap smears, having pain with penetration, unable to use a tampon. So that's like a really cool population that I've been working with. And honestly, some of my most favorite clients to spend time with, because college girls are just, I feel old when I'm with them, but they're so fun. Like it's been
Yeah.
such a cool experience. Honestly, I'm like learning new things all the time with
Right.
them. So there's, and you know, painful, like pain with penetration or like pain with paps is not exclusive to that age group. It's just,
Mhm.
I think that's where we're starting to see a lot of like the universities and the OBGYNs starting to send the referrals younger and younger. Um, and then I see a lot of patients who are around like the perimenopausal and menopausal age. We see our ovaries are no longer needing to produce the estrogen that we needed during our childbearing years. So that creates some changes in the tissue that, you know, patients might have more dryness. They might start seeing or feeling more symptoms of a prolapse as their tissue is adjusting. They can have more pain with penetration. We know too, like estrogen affects all of our other joints and muscles. So a lot of my patients will start to have like, you know, hip bursitis, shoulder tendonitis. So not necessarily pelvic health, but we're starting to see like the role that that hormone has on our body and how it can affect all of our tissues. So menopause is definitely a large percentage of, I would say, our patients that are coming in now, which is great because we never used to like research talk about or really do anything with menopause. So
Mhm.
it's cool that we're starting to find that pathway. Um, and then one other population that's really cool that I've been able to see is I've worked in a clinic that had lymphedema therapists,
Okay.
and they would see a lot of patients coming from having breast cancer or mastectomies. But there was also patients who were having a surgery called a deep flap surgery. So instead of going like the breast implant route, it was using and harvesting like their own tissues to create
Mhm.
breast tissue. And they would have these like massive abdominal surgeries,
Oh.
and no one was really thinking, I mean, obviously the cancer is the biggest thing, right? Like, let's get them cancer free.
Mhm.
But how does that affect their core, right? So
Mhm.
I actually got a lot of patients from some of our lymphedema therapists that were like, hey, this person's leaking urine, their core is kind of shot. They have this gnarly scar that goes all the way across their
Yeah.
pelvis. Um, and so we think often like, oh, cesarean scars, like we can work on those.
Sure.
But I've been seeing a ton of abdominal surgery scars, patients who had like hysterectomies that they had to go and open up a larger
Oh.
incision, gallbladder surgeries that had large incisions back in the day. So even just patients who have like it's scars or incisions that are causing them discomfort or weakness in their core. So that's another cool one that I've been seeing more of lately.
Yeah, very interesting.
Yeah.
Can you share a success story with us where you've been able to make a big difference for someone?
Yeah. So one of my absolute favorite patients, I love all my patients, but this one was a first time mom. She was actually an occupational therapist herself, had nothing to do with the pelvic health field. So she came in and was like, I know some stuff, but I really don't know much. And she had an oasis tear. So what happened is during her vaginal birth of her child, she had an obstetric laceration that tore through her perineum, and it tore through her anal sphincter as well. And then during her recovery, she ended up having a dehiscence, which means that the incision opened up. And that's when you can worry about infection and abscess. So she then went on to have a revision surgery.
Wow.
So she came into physical therapy, and she was such a positive person, but she, you know, made comments that were like, yeah, it's totally different experience than like you're in a diaper because you're literally pooping yourself, and your newborn's in a diaper because they're pooping
Sure.
themselves.
Yeah.
And she's like, for some people, it's short term, but she's like, this has been kind of long term for me because of everything that's happening with the healing. So she did phenomenal. We were able to get her coordination and her strength back. We were able to get the pain down around the scar tissue. We were able to get her bladder functioning really well. She was very active before before the pregnancy and during. So we were able to get her back to some physical activity. But I think like one of the coolest days in my career was when she got back from towards the end of her care. She went to Mexico for a destination wedding with a lot of her friends. And she was like, Chelsea, I drank alcohol in a bikini in a pool in front of people. She's like, I didn't pee urine all over myself, having bladder irritants. She's like, I didn't leak stool anywhere. And she was like, I was able to like eat and not worry about my bowels or leaking. And she was like, and I was able to like dance and like play in the pool and not worry. And in that moment, I was like, this is actually one of the coolest things ever.
Yeah,
Because
that's amazing.
her confidence changed. Like day
Yeah.
one, she came in and she was like, I'm in a diaper. I can't do
Yeah.
anything. And then at the end being like, I was just in a bikini all week and like
Right.
had no concerns. So, and she danced at a wedding and didn't leak. So
Right. Oh, that's
yeah,
amazing. I love hearing stories like that because I do think, I mean, especially, in a situation like that, like it can feel hopeless and just like, where is this going to go? Is this my new life? Like, can I ever feel remotely like myself again? So hearing stuff like that's incredible because it really just does just shine light on the fact that even from, I mean, in that situation, something really hard and like a major thing to come back from to go to that is so cool. So, thanks so much for sharing that.
yeah. The
That's
body's
a
meant to
great,
heal. The body's just
right.
amazing.
Yeah. And it can, and I think that reminder is so helpful because in those moments, like that early postpartum and you're experiencing all these things, you feel like, what has happened to me? Because you're already not feeling like yourself. And then you add on this thing that you didn't even anticipate. And it's just, yeah, hearing the body's meant to heal and those things, I think is very powerful for people who are in the throes of, an experience like that. So,
Yeah.
thank you. Great.
Yeah.
I know, let's see, what else? I wanted to ask you a little bit about how you approach staying current with the latest research and techniques in pelvic floor physical therapy.
Yeah, so I love continuing education. So we obviously, as licensed providers, have to maintain like a certain level to maintain your licensure. But I have gotten certifications through Sarah Duvall's like pregnancy postpartum corrective exercise specialist, and that's awesome because with her programs, whenever she brings out a new version, so like when I took it years ago, it was like the PCES 2.0 and she just came out with the 3.0 and you have full access to that, which is
Cool.
awesome. So
Yeah.
as she updates the research, she shares the wealth and the knowledge of that. And then the other big thing is I'm actually a teaching assistant through Herman and Wallace, so the Pelvic Rehab Institute.
Mhm.
And so I will TA a lot of the Herman and Wallace pelvic floor courses where they have on-site labs. So
Cool.
that's pretty cool because same thing, they're updating the research all the time. I have to, before any course, review the information. I'm sitting in on the lectures with all of the instructors, and I also take classes through them still myself. So that's another really cool thing is they're always coming out with new classes. So constantly
Awesome.
learning.
Yeah.
Yeah.
I feel like I like to do that myself, but I feel like in this space, like the more people I talk to, like they are kind of those continuous learners, like by nature, and so it like works really well, especially I don't know when I feel like there's so much new stuff coming out, in this space. So it's neat to hear how different people are staying plugged in.
Yeah. There's a lot of
Another
really
thing,
great books too.
oh yeah, I bet, I
Yeah.
bet. Another thing I wanted to ask you about was I feel like oftentimes, especially thinking about like our pregnant or postpartum folks or people at any stage, a lot of times I think it can feel like it's all on you. Like it's your issue, it's your thing to navigate and your thing to like overcome. Can you talk a little bit about how if those people have significant others or partners or maybe even friends or family, like how their network can help support them as they're going through this journey?
Yeah. I mean, I think as a lot of times are you talking about like specifically postpartum?
We can talk about that. Yeah. I mean, I think that would be a great time because I think a lot of
Yeah.
times, even postpartum, it can feel like, oh, it's all on you. So yeah, let's just focus
Yeah.
on that phase. Yeah.
Cool. So I think a lot of times, especially as women, we're very much cast into this like superhuman superhero role
Mhm.
where we are expected to like run the family schedules and like help with
Yeah.
the cleaning and the laundry and running, juggling your career and families and all that. So I think for every partnership, I think having a conversation on what might be the most helpful to allow these people to get the care they need. So for some people, it might be like, allowing the time in the schedule where childcare can be available for someone to go to their appointments. Or maybe if for someone, the physical toll of on their body is something that they really need more assistance with. Other times it might be more of like the emotional toll because like it is this like hormonal time in our life where things are very different and we might feel a little lonely or isolated in it. So sometimes more if there's, a chance for them to go to more mental health therapy or chat with a friend or allow that space and just make the space available, whatever that might look for. I have some patients who during the pregnancy will bring their partners in. We go through birthing
Mm.
positions. And I think that's really helpful because a lot of times someone's support person really wants to be able to help and isn't quite sure what that
Yeah.
looks like or what that might be. So I teach a lot of support persons or partners different ways that they can help during labor, different ways they can help in the postpartum experience. And even if it's little things like keeping this little caddy stocked that has
Mhm.
like snacks and wipes and hydration.
Yeah.
But I think the biggest thing we struggle with is time. And if we can just create making it a priority for patients to get to their appointments or have someone come into the house even or whether it's virtual. So I think the best support in a partnership is figuring out like what is it they need the most and then showing up for them in that way.
Mhm. Great. Yeah. Thanks so much for sharing that because I think it's helpful to hear the different perspectives of how you can show up and how that can look different, from person to person. So I love getting to hear what people think on that topic. Okay, the last question I wanted to ask you is if someone is hesitant to seek help or maybe isn't sure, what is something that you would tell them, to try to encourage them or make them feel more confident in a decision?
Yeah, I think I haven't met a single someone in like the women's health space that isn't like kind and empathetic and willing to listen. So if someone's not sure, I think finding a provider in their area that might do like a free discovery call or connecting with some providers, even through social media, whatever, and just get a little more information because I think what we don't know causes us a lot of anxiety.
Mhm.
So I think most of the phone calls of my patients or future patients, or maybe it might not be a perfect season of life for them right now to start, but of patients who you generally will have a call with, they're really grateful. And usually they're like, wow, I feel so much better after just a conversation. And it
Mhm.
doesn't mean they're going to start now. It doesn't mean they're, never going to have physical therapy. But I think the biggest thing is just talking to someone about pelvic floor physical therapy, what someone's treatment style is. Some patients are really nervous because of past history. Some patients just aren't comfortable with the idea of like someone, treatments that involve hands-on care. Some patients just are like, you can do whatever. I just want you to tell me what you're going to do first. And
Yep.
that's something like every provider I've met in pelvic health is very big on consent. So,
Mhm.
explaining like, here's our options, nothing's mandatory. You ultimately get to decide what we do. Here's my recommendations. And usually just getting more information, knowledge is power, like patients
Yep.
tend to feel a lot better.
Yeah.
So,
No, I appreciate you sharing that because I think if people hear like, oh, I can do a discovery call or things like that, I think accessing folks like you, it is different than accessing your other healthcare providers because you can get some of that one-on-one time and you get more time when you're talking with them versus let me cram it all into just a few minutes and then I get 10 minutes to be seen and then I'm out the door with whatever, the thing is. So I think the more people that know that, the better chance we have of folks finding the right care. So I appreciate you sharing that with us.
yeah.
Well, thanks so much, Chelsea. Is there any other parting words you want to leave us with before we wrap up?
Honestly, just like thank you for your business and like for advancing care and women's health. Like this is such a need. Like I have so many patients who are like, every time I offer them something to help them feel better, they're so grateful. And it's usually like, I offer them the skills I have, but having, someone like you who has things that are specifically made for patients who are having symptoms, specifically prolapse. Like, I have like 3 providers right now who work, 2 in an OR, 1 in just like a clinical office as medical providers, that are on their feet all day. And they're like
Yeah.
in there, either they're in a subsequent pregnancy, they're postpartum. And you're really helping so many people get back to like their own professions, their own careers, their own lives. So I just want to say thanks to you,
Yeah.
because
Thank you.
it's a huge group effort. And I just
It is.
absolutely, yeah, I just absolutely love having like legitimate resources to provide my patients to
Yeah.
help.
Yeah.
So
Thank you so much, Chelsea. I really appreciate it. And thank you so much for your time with us today.
awesome.
Thank you.